Hi everyone, this is Grace here. I hope you all are doing well. So, chest symptoms caused due to anxiety. How annoying and frightening those can be, isn't it? I hear you, I feel you. In this video, we're going to talk about the chest symptoms and why does anxiety cause so many annoying chest symptoms. I will not be talking about how to manage those symptoms. I have made a detailed separate video. If you want to jump to that, I'm going to add a link to that. You can just check the screen and you can go and get the solutions from there. But in this video, we will be talking about what are the different symptoms that, in terms of the chest, that anxiety can produce. Usually, for a lot of people, anxiety starts with the first episode of palpitations. It's not, rather, I would say, your first realization that you are having anxiety or you are dealing with anxiety usually starts either with the first panic attack or with the first episode of palpitations. It's not that before that you didn't have anxiety, you had it, and probably it was even severe, but you didn't pin it down to anxiety because your anxiety was producing just the sense of fear inside you, and it was producing all those myriad physical symptoms. It could have been headache, dizziness, nausea, muscle weakness, vision changes, all of those. Probably it was that. But usually our first realization that knock knock, hello, anxiety is here, happens when we have palpitations and we have a high heart rate, or we have the first panic attack. That's how it begins. So what are the different chest symptoms? It could be a very high heart rate, it could be a racing heart, it could be a lot of chest pain, different kinds of chest pain. If there are 10 people with anxiety, you ask all those 10 people, they will all give you a different description of how the chest pain feels to them. So sometimes it can be just a dull aching pain in the center of the chest. Sometimes it can be a left-sided pain. Sometimes it's the squeezing pain, which is very frightening and makes you feel that indeed it's a heart attack. Sometimes it's just a dull ache which comes and goes, seems to be, floating from one place to another. At times it could be a stabbing pain. Sometimes you feel that there is a very heavy weight kept on your chest. Sometimes you feel that there is a sense of tightness, a band around the chest. Sometimes people describe it as there is a stone kept on my chest, or I feel that there is lead kept on my chest. Sometimes there's this banging in the chest, especially when you have palpitations. There's this thud, 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 thud feeling, and sometimes the heart rate may be just going to 120, 130, but the palpitations are so loud and so strong that you just have to stop doing whatever it is that you're doing and sit down and let the palpitations go. Sometimes it's a pulling sensation. Sometimes people describe it as it's just a constant pulling inside. It feels like something's being pulled inside, as if you've done a lot of chest workout and there's a sensation of being pulled, or there's just constant something feels moving inside the chest. It's like you want to forget you have chest symptoms, you want to forget you have anxiety, but the damn chest symptoms keep coming back, and there's this constant moving, and even though you want to forget about your anxiety, your chest symptoms just don't let you forget about it. It could be that. Sometimes people describe it as, the sensation when you have cried a lot, when somebody has cried a lot and you're just so tired and you're sighing so much and you feel like there's all this, everything's just tight in the chest. It could be that. It could be along with this, people also describe the symptoms as they also have experienced sweating of the hands, sweating under the armpits, sweating here in the center of the chest, and in the back, the middle of the back, there is sweating. There could be other symptoms which are not directly from the chest but give you the perception that something is related to the heart. It could be tremors, it could be dizziness, it could be you feel as if your blood pressure has shot up. It could be dryness of the mouth, and it could also be a pain which is radiating to your left arm. There is tingling of the fingers. There could be a feeling of numbness in the hands, especially of the left side. So all of these symptoms. Along with this, there could also be nausea. There could be difficulty in swallowing. You feel as if instead of going down, you feel as if there's something constantly coming up, like there's this ball coming up and constricting your throat. That is also a very, very common symptom. Some patients also complain of a sense of a skipped heartbeat or a fluttering in the heart. You feel as if your heart has skipped a beat and then thud, it starts beating again loudly, literally feel as if it has stopped and it has started. Gosh, the myriad symptoms, chest symptoms that anxiety can produce. So these are all the various symptoms. If I have missed something and you experience the chest symptoms in some way that I have not described, please leave it in the comments. Please take the time to write it in the comments, because it will help somebody else who's going through these chest related symptoms. And it's just a kind of reassurance that I'm not alone, and somebody else also is experiencing these symptoms in a similar way. So, what causes all of these symptoms? Why does anxiety produce these symptoms? Again, a disclaimer, I'm presuming that you have indeed got yourself checked by a doctor, preferably by a cardiologist. The question, why does anxiety cause chest symptoms? Why the chest? Especially when heart related anxiety is something that it can be so frightening for anybody, even somebody who has a healthy lifestyle, who has no history of heart disease, who has been very athletic and exercising every day. Even such a person, when you get a heart related symptom, it can be very frightening, and you suddenly wonder what's going on. Sometimes just sitting and relaxing, having a good time, probably in a restaurant, or you're just relaxing, or you decide to take a nap, or you're watching TV, and suddenly the palpitations keep coming up again and again, or the chest pain keeps coming up, and you wonder what is going on. Why doesn't this stop? So to understand why this happens, it's first important to know how the body works, the simple mechanism of the fight and flight, where when you are stressed, when you go through a stressful experience, your body goes into the fight or flight mode, which is supposed to happen. It is normal, it is a healthy response to enable you to deal with the situation. And once the stressful situation passes, the body goes back to its normal state. Homeostasis is maintained again, and you go back to living your life where all the stress hormones come back. And there is always this balance between the two parts of your nervous system, the sympathetic nervous system and the parasympathetic nervous system. The parasympathetic nervous system is the one that calms you, that relaxes you, and the sympathetic one is the one that helps you to deal with stresses, which helps to activate the fight or flight mode. Now, why does one get into this anxiety state? When you have had a lot of high stressful situations in your life back to back, or very for a very long period of time without times in between for your body to rest, that is what sort of makes your body not understand whether it is supposed to be in a state of stress or it is supposed to be relaxed. So let's say you have had very high periods of stress which has gone on for a couple of months, and you have been very fearful during those times, and your body has secreted cortisol and adrenaline and all of those stress hormones in order to help you deal with those stressors. Now your body is not able to understand, and it thinks that it's always in a state of stress, because that's what you have, not deliberately, but because of your life situation and your response to that life situation, you have in a way taught your body that, and your body and your brain has got trained to do so. So because over that period of time, over that stressful period of time where you have not given enough cooling period for your brain and for your nervous system, now your brain has learned that you are always in a state of stress, you are always in danger, there's a threat always around you. And because of that, cortisol and adrenaline is constantly being secreted several times during the day, because your body is just trying to protect you. Your body thinks you're always in a jungle, the tiger may attack you from at any time from any direction. So there's no time to just relax, you have to be very watchful. You don't know where you're going to be attacked from, which is why your body randomly, you may be thinking, oh, I'm having such a good time, I'm watching something relaxing, having my chamomile tea, and suddenly out of the blue, my heart rate is going so high. It's a Sunday today, why am I having palpitations? I thought I'm relaxed. But it's just your nervous system which is not knowing, which has got trained to function this way, and now it's randomly secreting these hormones of stress. What do these hormones of stress do? When it's preparing you to go into fight or flight mode or run away from danger, it's naturally going to make your heart rate go high, it's going to make your respiratory rate go high, it's going to take away the focus from other systems of your body like digestion. So it's not going to focus on digesting food. If a tiger is running after you, you're not going to think about digesting the breakfast that you had, right? Hell with the breakfast, there'll be enough time to eat more meals and digest food later, provided you stay alive. So that's what your body is doing. It's trying to keep you alive because it believes that you are always in a state of danger. You can retrain your body to do this. That's very much possible. But now we're not talking about solutions. We're just understanding why this happens. Understanding why it happens is so very important, because only then you can respond well when the symptoms come. If you don't know, imagine if we didn't have this knowledge, if we didn't know why it's happening, we would just be so afraid every time that, oh my God, something is wrong with my heart. Otherwise, why would it just randomly beat like this at 120 and 160 beats a minute, just, keep racing out of the blue? And indeed, the doctors have missed something. That's what you would think. But when you have the right information, when you know, it just helps you respond better, which is why I think it's important to take the time to understand it's your body after all, and you need to understand why it is responding this way. So, coming back to the point that it's these stress hormones which randomly your body is secreting several times during the day. It does not matter whether you're stressed, whether you're relaxing, whether you're sleeping, whether whatever you're doing. This is causing, every time the adrenaline and cortisol come into the system, the body is then responding with a high heart rate. And that's what is happening. That's why the heart races, that's why the palpitations. Now you may ask, okay, but does the pain also have to come every time? Does the chest pain have to come? Does the tingling have to come? Does the sweating have to come? Now, all of this, there are some other reasons for it. For instance, the adrenaline, also the stress hormones, the adrenaline and cortisol also cause a lot of tightness of these muscles of the chest. The intercostal muscles. Intercostal muscles are the muscles between our ribs, the neck muscles, the back muscles. There's a lot of tightness in these muscles because of these stress hormones. Also, several times during the day, we, without knowing it, we are hyperventilating. That is, we are breathing very quickly. We are taking quick, rapid, shallow breaths. That also causes a lot of tightness. And imagine if you are working out your biceps several times during the day. You're working it out every day, several times. No rest, no warm up, no nothing. Just pick up a heavy bicep, a heavy dumbbell, and just go for it. What's going to happen? It's going to go into fatigue, right? It's going to give you this ache randomly unless you give it time to rest. That's what's happening to your chest muscles. Without knowing it, you have caused a lot of tightness by faulty breathing, by holding your breath, by this thoughts of fear, which also the stress hormones do tend to cause a lot of tightness, because that kind of prepares you to respond to the stress situation better. Because of that, it's the muscle pain which is actually causing this chest symptoms, these chest pains, and you tend to think that it is because of the heart. So it's not the heart, it's just the chest muscle pains which are causing your chest symptoms, the chest pains to come. Another reason is that, another important factor is that we do know what are the symptoms of a heart attack. We know that when a heart attack comes, we know that the heart is on the left side. It usually comes with left pain, left-sided chest pain, which goes to the arm, which causes left pain, heaviness, and numbness of the fingers. Now, when the chest pain comes, we tend to think that all of this is also happening. Very often, it's not happening. If you pay attention carefully, you'll notice that even the right arm, there is some heaviness. Even the right arm fingers, there is some tingling. But because we know, many of us don't know much about medicine or about health or about emergency situations, but we do know what are the symptoms of a heart attack. And very often that's what is happening. It's our mind which is actually producing these symptoms of a typical heart attack, where we are having pain in the left arm, heaviness of the arm, a lot of sweating, a lot of tingling. So am I saying that the mind is producing these symptoms? Very often, yes, there is that component too. Also, when we are having, the mind is such that when we are having chest symptoms, we are very, very sensitive to any little movement that happens in the heart, any little movement. It's funny that before you had your first panic attack, you would have had chest symptoms then as well. You may have had sometime, a little bit of pain in the chest, and you may have thought, okay, it's probably just acidity or muscular pain or something that I did, stretched a muscle or something like that. But after your first panic attack or your palpitations episode, you are super sensitive to anything that happens in the chest. Any little flutter, and you're like, oh my God, you're sitting in attention. What was that? What was that? So we are super sensitive to anything that happens in our chest. We are super sensitive to an increase in our heart rate. If you feel a little different, immediately you're like, oh, is my blood pressure gone high? Is my blood pressure gone low? What's going on? Something's off. Is a panic coming on again? So also this extreme sensitivity to any little movement of our body, that also, you know, gives you the feeling that yes, you are indeed having a lot more chest symptoms, whereas actually you may not be having that many chest symptoms. So it's all of these things put together. So this is what causes all of these symptoms and what causes you to be on high alert. Again, it's important to know so that you're able to respond to your symptoms in a better way. Can these symptoms go away? Yes, for sure. Please refer to the other video that I have made. I hope you have found this video helpful. Please give me a thumbs up. If you have any questions, put the questions down in the comments and I'll try to respond to them, and share this video with somebody who is having chest symptoms due to anxiety. I'll see you in the next video. Till then, take care.